Hi, everyone. Welcome to the IPO Education Foundation December event. My name's Henry Hadad. I'm currently Chief Intellectual Property Counsel at Bristol-Myers Squibb and former president of IPO. And I'm very excited to moderate this panel with a great selection of panelists on a really important topic, which is entitled Patent Rights in the Pandemic. And I know there's been a fair amount of discussion about the role that IP plays in responding to the pandemic, but we have a terrific panel that can really reflect on what the last 2 years or so have taught us about the role that intellectual property plays in addressing things like a pandemic. And I'm going to go in alphabetical order in introducing them. The first panelist is Florczak, who is currently Chief Intellectual Property Counsel for 3M Company and President of 3M Innovative Properties Company. The next panelist in alphabetical order is Robert DeBerardine. He is currently Chief Intellectual Property Counsel at Johnson & Johnson and previously held similar roles at Sanofi and Abbott, as well as a patent litigator in private practice. And last, but certainly not least, is Andrei Yanku. As everyone in this call knows, Andrei was previously the Undersecretary of Commerce for Intellectual Property and Director of the USPTO. He, as head of the USPTO, he oversaw one of the largest IP offices in the world, an agency with approximately 13,000 employees and an annual budget of more than 3.5 billion. More importantly, at least from my perspective, Andrei was always a clear and clairvoyant voice on the importance of intellectual property in advancing society, whether it's at times of emergency or not, and really look forward to his perspective on things. Andrei, before serving as the USPTO director, was a partner and actually managing partner at Irell and Manella, and is currently there as well in a variety of capacities. He has also been awarded innumerable awards. We could take the whole hour discussing them. I think we'll just go right to the heart of the panel discussion. So thank you all panelists. I'm going to start with our colleagues in private industry. Ian and Robert, how did your respective companies respond and contribute to the pandemic? And beyond those companies, your personal companies, how did the industry as a whole, in your view, respond to the pandemic? And we'll start with Ian and then turn to Robert.
Well, thanks, Henry, and thanks to everyone on this panel. This should be a really fun discussion. I'm delighted to be here and to be a participant of this esteemed panel. So, as you know, 3M has been a long provider and a leading provider of personal protective equipment to the public, including medical professionals. And so our response to the pandemic is we're most known for our N95 respirators. And we have other products too, including our power air purifying respirators, our reusable respirators, single patient use stethoscopes, and separation and purification members used in the vaccine industry. So when the pandemic hit here in the States in March 2020, our CEO, Mike Roman, articulated a very clear purpose. And our purpose was that 3M had a unique and critical responsibility in pandemic preparedness, a responsibility we take very seriously. And as you may have seen in the media, there's been a lot of coverage about 3Mers around the world working tirelessly to ramp up our global manufacturing capacity of the disposable respirators. And by the end of last year, we manufactured 2 billion disposable respirators globally, 3 times what we made in 2019. And in terms of another way that we responded to the pandemic was we really stepped up and fought against wrongdoers who exploited the pandemic, who scammed customers by making fraudulent offers of the N95 respirators, counterfeiters and price gougers, and other unfair practices, all really creating a public health and safety threats to the consumers around the world. So I'll stop there in terms of how 3M responded to the pandemic and pass it over to my colleague, Robert.
Thanks, Ann. Yeah, Henry, in some ways, 3M's response is similar to what J&J did. You know, we looked across our portfolio of products, and we have three sectors. We have consumer products and medical devices, and then pharmaceuticals. And in the consumer products, we looked at our products around symptom relief. And so we focused on that, and we increased production on our symptom relief products, something like Tylenol. And then in medical device, we looked across all their products there, see how we could help. And we came up with some products that helped around breathing apparatuses and how you can increase their efficiency and how you can increase their use. And then, of course, in the pharmaceutical world, we looked across all our different products there. Some addressed the immune response, some addressed, the vaccine response, which is ultimately what worked for J&J. But again, we looked across all our products and tried to figure out how can we best respond to the needs of the pandemic, which were very varied. And in a lot of ways, the whole pharmaceutical industry, and I'll stick with pharmaceuticals because Ann has a very good story to tell around the manufacturing process. But in pharmaceuticals, you could see the whole industry doing that. Every pharmaceutical company has different expertise and different products that approach different biological targets and different biological pathways. And you saw all those companies trying to look at their products and say, how can these products be applied to the COVID crisis that we were facing and we're still facing? And I think it was an incredible industry response to really look across all those products, try to apply those products in a constructive way to the challenges we were facing in COVID. Some of them worked, many of them didn't. Which sort of signifies the challenge that pharmaceutical companies always have in trying to find solutions to healthcare problems. But certainly the whole industry really dedicated itself to trying to use what it had and what it had been working on and apply it to this COVID challenge that we had. So that's a quick snapshot, I think, of what J&J did and also what the pharmaceutical industry did.
So Henry, just let me follow up with Robert's comment there. I think as we went through the pandemic and we're still living it, as Robert indicated, I was just astounded. When we looked back at the facts in 2020, 3M had fielded more than 1,100 potential partners to collaborate on the ways to fight the pandemic, just exactly what Robert said. And at the height of the pandemic, we had on a daily basis, more than 100 requests per day for partnership, from large multinationals to small businesses to startups to governments, different types of potential partners, ones who wanted to manufacture, those who want to help with supply chain, those who really want to do technology collaboration, and even sourcing relationships. Now, I'll say that at times, I'll just have to admit, honestly, that our teams felt a little bit overwhelmed, but it was just so heartening to see the outpouring from industry on how to collaborate, to work together to battle the pandemic. So I just wanted to share that thought too, is that we as a society can really come together and work to fight this pandemic. And we've shown that we can have done that thus far. All right, back to you.
Thank you, Ann, and thank you, Robert. Both of your companies, to me, are shining examples of what private industry can do to contribute to solving the world's problems, and are also emblematic of greater efforts across industries to do the same. So I'm going to turn to Director Yanku for the next question. As in your role as USPTO Director, you got a firsthand look at the government's initial response to the pandemic. And you also got a sort of a catbird seat of looking at how government, industry, academia collaborated to form a solution. And I'm interested in hear your observations about that.
Well, thanks, Henry. And first of all, great to be with all of you. Great to be back with the IPO Educational Foundation. This is a wonderful, critically important event every year. Sorry, it's not in person this year, but hopefully we'll get back there soon enough. And it's good to be able to do it electronically if we can do it in person, at least for now. Yeah, look, so first of all, let me answer the question, Henry, by saying the United States, I mean, this might sound obvious, but it's really important to emphasize in today's world, the United States needs the private industry in order to to advance innovation and to bring to market critically important life-saving technologies, such as the various technologies that have come forward in response to the COVID-19 pandemic. And as it turns out, it is important for industry to collaborate with government where necessary and vice versa, and government needs to facilitate, make sure that industry has what it needs to be able to respond at its full capacity. That did happen in response to COVID-19. One of the main projects back then was Operation Warp Speed, and industry's response was incredible. It was frankly unprecedented. It was quick, and it was deep and meaningful. So two key issues that were exemplified in the response. First of all, as we've heard both Ian and Robert, whose companies were the forefront of the response, industry went to find out which existing technologies already invented, already developed over a long period of innovation and investment backed by the intellectual property system, what did they already have that can be immediately deployed? And there were quite a few of those things, such as PPE and certain types of medications. So that's number one. Number two, new inventions were immediately put into operation. So industry went back to the well, figured out what technologies they have and what can be built upon the current system to bring to market new technologies to address the pandemic. And it worked incredibly well, right? So in less than a year, we had multiple vaccines. We had lots of additional PPE type of equipment, respirators, so many other inventions in record time. I want to emphasize, none of that would have been possible, again, without years of innovation that came before the actual pandemic. So we have to remember this, and I'm sure we're going to talk a bit more during the program. We have to remember this because this is not going to be the last emergency that the world will face. And we have to make sure that our industry, our private industry in the United States, always remains prepared to respond this quickly. And finally, and this is also important vis-a-vis industry's response, once invented, once identified, industry collaborated at unprecedented rates with each other and with various governments, both in the United States and overseas, to manufacture and distribute these life-saving technologies. The number of collaborations, and this was clear while I was there, and it's been clear since in the last few months as well, the number of collaborations, the depth of collaboration is unprecedented. And again, none of that would be possible, especially with such complex and expensive technologies. None of that would be possible if companies were not able to comfortably rely on the intellectual property system that protects their innovations. Having the comfort, the understanding that their technologies will be protected, they were able to enter into collaboration agreements across the world, including with some of their main competitors. And I'm sure, again, we'll talk a bit more about that as the program progresses.
Thanks very much. That's a great transition to go back to our colleagues in industry and ask them that very same question, which is what was the role of intellectual property in facilitating the response to the pandemic, both from your own personal experience as well as from an industry perspective. We'll start with Robert and then we'll go to Ian.
Thanks, Henry. And I think Andrei sort of introduced the topic perfectly. to me, especially in the pharmaceutical industry, IP is really about diversity. It's about doctor and patient choice. If you induce people to come up with new ideas and to come up with proprietary solutions to problems, you're going to have a lot more solutions. If you're inducing simple copying, if your first response is, okay, there's a solution, now let's copy it, you're discouraging people from coming up with different solutions. And so the head start that we had across the pharmaceutical industry was there were many people who had many different approaches to many different ways of solving this problem. And if you look at COVID-19, the ultimate problem with COVID-19 was really the symptoms. People couldn't breathe. And that's because of an immunology response by the body. So we had a lot of different approaches to solving that immunology problem, that immunology response to the COVID-19 problem. We had a lot of antivirals that you could try to sort of attack the virus itself. And because of the incentive of the IP system, there's a lot of differentiation between those products. And then, of course, you have the vaccine approach, which again, because of the differentiation across driven by IP, you saw a lot of differentiation there. You had the mRNA approaches, which is Pfizer and Moderna. You have the vaccine, the more traditional vaccine approach of J&J and AstraZeneca, and you had other approaches, not to mention other small molecules that were used to treat other disease states that were applied to the COVID-19. So all these various responses and all these shots on goal were driven by the IP system that had encouraged people to develop proprietary approaches to problem solving. And the other thing I want to talk about IP that I think was critical, and again, I think both In and Andrei have brought this up, is the partnering. Now, if we're just allowing unfettered copying, if we're just going to say, okay, here's our IP, anybody can use it any way they want to, you have no control over that process. And to me, it's sort of like there's a difference between buying a brand name product in a brand name store versus buying a similar product on the street corner. And the difference is the expectation of quality in that product you're buying. And when I'm buying technology or a product from either the company that developed it or a licensee of that company, I can have confidence in that product. If I'm buying it from someone that I don't know the source, where does that technology come from? Are they licensed? Are they the person on the street corner, or are they that branded store? My confidence is much less. And I think people fail to recognize, not people on this panel, but I think a lot of people in the world fail to recognize that by having IP and by licensing that IP, you really ensure a safe environment for the use of those products, and you can control who is developing those products, who's manufacturing them, and who's distributing them in a way that you can have confidence that when people are taking the product, in our case, a pharmaceutical, that it's a safe and effective pharmaceutical. Thanks, Henry.
Thanks, Robert. In.
Yeah, so I'm going to follow up with Robert says, on the 3M side, the intellectual property systems that help facilitate our response are twofold. On the one hand is the trademark law, like Robert just talked about, making sure the source is appropriate. And 3M really leaned into the trademark law and used the trademark law to go after wrongdoers. And they would use tactics to mislead the buyers into thinking that 3M had authorized these exorbitant prices, sometimes as high as 500 times or high 500% of our selling price for disposable respirators. So on the one side, we were using trademark law to help protect the consumer and the frontline workers at the end of the day, so that they wouldn't be price gouged and they're not getting counterfeit products, right? A counterfeit disposable respirator doesn't have the same quality, the filtration efficacy that N95 would. So that's on one hand. On the other side of the IP system that we leverage on is what Andrei talked about, is the years and decades of innovation that 3M had invested. And it's an investment that we've put into our equipment, into our manufacturing processes, into our plants to make these disposable respirators, these air powered respirators, everything that could help the frontline workers to stay safe during the pandemic. That was decades of investments, decades and continuing innovation that we put into the system and helped to battle the pandemic. You also asked about partnerships. We've talked about that a lot. We did do partnerships with academia. We had signed an agreement and worked really hard with MIT to help to develop an antigen test, like an immediate test to shorten the time. Now, as Robert said, there are many times that it didn't work out, and this one didn't work out. But for companies like 3M, in partnership with MIT, made that investment to try and battle against the pandemic by providing fast, rapid testing. So those are some of the things that we did, how the IP system really helped companies like 3M fight the pandemic.
Thanks, Ann. So what I'm hearing is that from your perspective, the IP system ensured that there was a robust technological bedrock to build upon to respond to an emergency situation like a pandemic. It ensured that people felt comfortable partnering and providing licenses to their IP and opening basically their technological information up to others because they knew they had a way to protect it in a meaningful way. And it also seems to be something which ensures quality of the ultimate product, both in terms of the trademark side and in terms of the IP side and frankly, the trade secret side. So these are all things which clearly contributed greatly to the IP system. Yet, Director Yanku, I have heard other murmurings that critics say that patents are a barrier to our response to the pandemic. I know you've been outspoken on that, but we'd like to hear your views on that. And what are the proper appropriate responses to those type of critiques?
Yeah, well, look, first of all, the main question I have in response to that critique is, where is the evidence? Show us the evidence that in fact patents have acted as a barrier in the response and uptake of COVID-19 related technologies. As it turns out, we have more innovation at a higher, at much faster rates than ever before. So where is the evidence that if we did not have a patent system, we could have had even more innovation and at even faster rates? Show us the evidence of that. Show us a different system that actually has worked without a patent system, a reliable patent system. Or at least show us the theoretical analytical studies, something that is convincing. This is such a critically important issue, Henry, and I believe, and I've stated publicly, that governments have a responsibility to show the evidence to the public before they make a radical change and upend a 100-year-old system that has been responsible for the highest level of innovation and the highest levels in standard of living in the entire history of humanity. Show us the evidence that actually, number one, the patent system is a barrier, and number two, equally important, that whatever you're proposing in lieu of it will work better. Here is a critical issue that I think is important, especially for the IP Owners Educational Foundation, which is this. There is a perception in certain circles, both in the United States and around the world, that innovation just happens, that there are various factors that go into the innovation ecosystem, perhaps education, STEM education, and appropriate levels of R&D investment and the like. And it just happens irrespective of the patent system. And that some clever folks, after the innovation happens, go out and take patents of what has been invented, so to block their competition from further innovation or from developing a competing product. Again, I ask, where's the evidence for that? I think we, folks who really are deep into the patent system, we need to increase our educational efforts of the public and decision makers and policymakers to make clear that innovation doesn't just happen without the patent system, that the patent system is a necessary, although not sufficient for sure, but a necessary component for that innovation. And finally, let me leave you with this. There is a reality out there. The reality is that access to vaccines and other medical technologies around the world has not been equal. And there are countries that have significantly higher access to vaccines for the past year since they've been introduced. And there are some countries that have significantly less access. And in an ideal world, we certainly would have equal access across the planet to such life-saving technologies. But two things in response to that. Number one, this is not a patent issue. If anything, a robust patent system will increase the access to vaccines around the world because, again, as we have all said in the past few minutes, manufacturers will feel more comfortable to partner and distribute their vaccines across the globe. In addition to that, there are clear indications that there are a whole host of other issues, regulatory issues, logistical issues, refrigeration issues, transportation issues that come into play that have absolutely nothing to do with the patent system. As a matter of fact, we already have, as predicted, enough vaccine doses to vaccinate the entire adult population of the world. And there is recent news, and I think at least Robert and probably Ian can discuss this with in more detail. There's been recent news that unless something happens by the middle of 2022, there will be a glut of vaccines around the world, too many. Why are we in the middle of suggesting that we should upend the patent system in order to increase the access to vaccines when in fact the current systems have produced vaccines and other technologies at unprecedented rates, and we will have sufficient amounts for the entire population of the world.
Thank you very much, Director Yanku. That same critique that you referenced seemed to fuel the US government's support of the TRIPS waiver. And I was going to ask Ian and Robert, what is your perspective on the TRIPS waiver as it applies to the current pandemic? And do you believe it will actually facilitate the access to life-saving technology? So why don't we start with Ian and then we'll go to Robert. And then I'm going to turn back to you, Director Yanku. I want your perspective on this as well.
Well, thanks, Henry. I echo everything that Director Iancu has said. The TRIPS waiver, in my view, will not facilitate additional access to the vaccines. And in fact, into other PPEs, we do already have a lot of PPEs on the market. As Director Iancu said, really, if you think about a company, it has to figure out where to make its investments, right? And innovation, in essence, requires taking on a lot of risk. So we have to figure out how to make significant investments in view of the risk. And we want to, it's just logical and understandable that the cost and uncertainty in investments, you have to get a return for it in the development of products, services, right? And to make, not only to make products, but to build businesses, to build manufacturing, and what really it's to build good jobs. It's at the end of the day, it's to provide good jobs for the citizens of the world. So having these clear and reliable IP rights, as we have said before, they also facilitate collaboration. I mean, 3M and Ford, 3M and Cummins, 3M and other companies couldn't get together unless we had the clear IP rights among, and then how do we collaborate across these companies, across geographies? So my view is, in terms of the TRIPS waiver, having access, waiving the patent right is not a solution. 3M has always said that we would always entertain, if you want a license, if you want to make the product, we are more than happy to sit down and talk to you about whether or not the other entity would have the capability, because making a vaccine, making a PPE requires a huge amount of capital investment, requires clear understanding of supply chain, and amongst other things. And so it's just not, even if we took down the patents, the waiver did get into place, there is no guarantee, absolutely no guarantee that we would have more supply of these life-saving drugs or PPE products. In fact, if you took down the patent system, as Director Iancu said, you're going to undermine investments. You're going to undermine companies wanting to make investments into these sometimes very risky area in innovation. So I'll stop there and pass it to Robert.
Yeah, Henry, I think I'm going to be provocative unusually. So I think we're wasting our time talking about the TRIPS waiver. I think it's really a disservice to humanity because we're spending so much time and effort talking about something that clearly was not a problem to access to solutions to the COVID-19 issues that we are facing. And certainly when it comes to pharmaceuticals, I am not aware of one person not receiving one vaccine because of IP. And this goes to Andrei's point about where's the evidence that shows that IP has prevented anyone from getting a solution to a problem related to COVID-19. There just isn't any. But I do also want to say that governments have a bias. And to governments, because governments are purchasing pharmaceuticals, they tend to think competition means price competition. And governments fall to the simple solution. If we allow copying, which of course it's very cheap to copy, we can drive price down. But they're not serving their constituencies, because true competition, especially in healthcare, especially around pharmaceuticals, is product competition. What you want are multiple solutions to a problem, because we know that human beings are very different. We know that the next pandemic is going to be different, and we know people are going to respond differently to those things. And the more choices that we have are going to ensure that more people have more solutions. If you just rush to copy the very first solution and you don't support IP to encourage new product competition, you're going to have one product to sell. And I don't care what the price is. If that product doesn't work for you, or if that product doesn't work for the new virus that shows up next year, we're all in deep trouble. And so when you talk about competition, sure, we have to talk about access. Access is critical. And it's unfair, and I think everyone would agree with this, it's unfair if poor people have less access to life-saving pharmaceuticals than wealthy people. That is not a good solution. But we have to talk about how do we solve that access problem. And there are a lot of things that go into it, as and Andrei have indicated already. But I do know this, the solution to that access problem should not be taking away the one thing that is creating the solutions to the problems, the healthcare problems. That makes no sense to me whatsoever. Why we're starting with IP as opposed to healthcare infrastructure, governments working with each other instead of against each other during the pandemic, training technicians, training scientists, building bioreactors, all the things that really resulted in a lack of access. When it came to the response to the pandemic, all the companies stepped up. I know in J&J's case, we provided our vaccine at a not-for-profit basis during the pandemic. We're still doing that. It's a non-for-profit basis. Pricing and IP was not a problem. What was a problem was a lot of the things that Ann and Andrei have pointed out, and we should be addressing those, not wasting our time talking about IP.
Thank you, Robert. It's tough to know where you stand on this issue. Before I turn this same question over to Director Yanku about whether the TRIPS waiver will facilitate ultimately its goal, I also want to acknowledge your role, Director Yanku, your former role, in negotiating with various IP offices around the world. And I'm also curious your perspective, what does the TRIPS waiver signal, or at least the US government support of the TRIPS waiver signal to those governments in terms of us ultimately standing up for the intellectual property generated by those companies which are really focused on advancing the next generation of therapies?
Yeah, so let me be a little bit even more provocative than Robert, if that's possible, which is, I frankly think that all this talk about the vaccine waiver over the past, it's much broader than vaccine, but the IP waiver surrounding COVID technologies has been tragic. And the reason it's tragic is multifold. First of all, as Ian and Robert indicated, there's no evidence for it being needed. There is absolutely no evidence that if implemented, it will get a single additional shot into people's arms. So it will affect, if it happens, it will affect the continuous innovation, both for COVID-19 related technologies, by the way, in the immediate term, but also long-term for our innovation ecosystem, so that we can be ready to respond to the next pandemic or the next crisis. And here is the biggest tragedy. All this international discussions, and they're in Geneva right now talking about this, the members of the World Trade Organization. All this talk about it has been masking the real problems. There really is an access issue. There really is a need for more equitable access to medicines around the world. It's got nothing to do, though, with the patent system. And it is allowed, this talk about the waiver is allowing governments to hide behind it and avoid addressing the real issues that are standing in the way, such as Robert's talked about, capacity building, which is a long-term problem, and governments have been avoiding to address this issue for decades. They should address it now. It doesn't happen overnight. There's a long lead time. Governments around the world and industry should work in collaboration in order to build capacity around the world so that we don't face this problem in the next pandemic years down the line. There are infrastructure problems that need to be addressed. As I said before, refrigeration, transportation, and the like. There are regulatory problems in every country. The countries that are advocating for this patent waiver or IP waiver have serious regulatory problems. They're sitting right now on huge doses of vaccines, and they don't have the ability, they don't know how to distribute them to their own populations. There are corruption problems and so many other things around the world. Those are the real issues. And instead of wasting time talking about an IP waiver, which will not get a single additional shot into a single additional human being, in fact, probably going to go the other way, the countries of the world, with the United States in a leadership position, should work to figure out real solutions to actually make a difference in improving access. So, to address, the main point of this question to me, Robert, is the United States always plays a huge role when it comes to leadership with respect to intellectual property around the world. Our trading partners look to us to understand where we stand on IP. For a long time, we led the way for a strong intellectual property system, both in the United States and around the world. And by the way, it's not a coincidence that the vast majority of innovation when it comes to biopharmaceuticals and when it comes to these technologies that we speak about right now that are here to treat COVID-19 and prevent COVID-19 related issues, medical issues. It's not a coincidence that they're coming from the United States. Our strong IP system over decades has allowed for this level of innovation. And also our ability over the past few decades to encourage other countries to have a robust IP system. And many of them have improved their IP systems in response, which is a great thing over the past number of years. That has enabled industry to collaborate at unprecedented levels and get these life-saving technologies distributed around the world in quick fashion. So the United States now being one of the leaders, one of the proponents of waiving IP rights, that has the potential of having a dramatic impact on our key trading partners who might, as a result, follow the lead of the United States. As it turns out, though, it does seem like a number of our key trading partners are not on board with the waiver, at least for right now, and we'll see where that goes in the coming weeks and months.
Thank you very much, Director Yanku. So that's an area of concern as we look down the road. And what I was hoping from Robert and In, a perspective as you reflect on what's occurred over the last 2 years, are we prepared for the next health emergency? What causes you to be optimistic and what causes you to be somewhat concerned about how private industry, government, academia will respond in the future to the next pandemic? So I'll turn it over to Robert first and then to In, and then we'll go back to Director Yanku.
Yeah, Henry, first of all, I do think that, again, we need to have the IP system to create new innovation. And that's going to be critical for the next pandemic because we don't know what's going to work against it and what's not going to work. And so having the multiple choices, having people investing in different types of approaches to problem solving around the healthcare space is going to be critical. And, and if we stop now, if we were to say, okay, we're going to allow everybody to copy everything today, we're going to have no more innovation. Everything might be cheap right now, but we'll be in trouble tomorrow. And so you have to have that balance, and which is what the patent system is actually about. You have that balance where after a certain period of time, the patent expires, you get to copy it, the price usually goes down, and then you will also, but you have the future new development that's going to be critical. And again, because we don't know what the challenge is going to be, the fact that we have brilliant people in academia, in private enterprise, in doctors, in the healthcare system, thinking about these problems and working on these problems, and then having the vehicle to be able to invest in their proposed solution is going to really help us in the next pandemic. I think we're going to have the same problem we have today. I think it's going to repeat itself because, again, we're focusing on the wrong things. I think governments need to get together and decide how are they going to assure fair distribution of pharmaceuticals and other things needed to address the next pandemic across different countries. I would imagine you're going to see the same thing that we saw during the COVID-19 pandemic, which is countries, certain wealthy countries, betting on hopefully productive technology, as you saw in Europe and the United States. A lot of the things that the countries bet on didn't work. Some of them did. But when those bets were made, they tied up the solutions. There was a lot of contractual obligations that J&J had to the United States. When that hits, and there's a political expediency to getting that solution to just the people of the United States because the United States spent its money on that, That's going to lead to a lack of people in other parts of the world getting it. So countries have to get together and reach solutions around how do we get the product out to all the people of the world? How do we get countries not to act nationalistically? That's one thing. Another thing that was going to have to happen is to what Andrei was talking about is who's going to make these things? How are we going to distribute these things? So we should be talking about all this infrastructure and all this, these national issues so that we can assure a global response. It can't work for everything, of course, but certainly for a pandemic, you really want to think ahead and you want to have a worldwide approach. But you also want to have the incentive, the private incentive for people to try new and different things. So to me, I think unfortunately, because of the way the conversations have been going, and again, I just to be provocative, I think a lot of the decision making now is being made on just pure emotion. It may sound good that IP is the barrier. It's not. Just let's look at the facts. Let's be empirical for a moment. And it may feel good to say, okay, we should just give everything away. But let's look at the real facts. And that wasn't the issue. People were trying to give stuff away. They just couldn't make enough of it. There wasn't enough supply. There wasn't enough bioreactors. There weren't enough talented people that knew how to do this stuff. We should be solving those problems for the next pandemic. I think so long as we have a patent system, there'll always be really great ideas that are made into products. I think that will be assured by the patent system, but I'm not sure those great products will get to the people that need them unless we do other things.
Thank you, Robert.
So let me, I'll be a little bit briefer because Robert's covered a lot of territory there. I think as I reflect back on 3M, what we've learned to respond to how we've responded during this pandemic and how would we do it in our next health emergency. For one thing, it's just putting those processes in place, having a playbook, setting up the fraud lines to help for consumers, to help as a resource for consumers to help understand the situation, what is a counterfeit, what's not a counterfeit. So that's one, really having that playbook put together has been very, very helpful for us, and processes do really matter. The other thing that I'm really heartened by is, even though it was hard, there was a lot of public-private collaboration. 3M could not have stepped up without the government's help in terms of increasing our capacity. So to some extent, they're helping with that, but it's got to be on a much bigger scale. This nationalistic attitude that Robert's alluded to has been really a problem, where we're trying to solve a global problem. And as a global company, we have a responsibility to our customers worldwide. And yet we saw some administrations being very nationalistic and blocking our abilities to, send products to other countries. So taking the barrier down, governments collaborating is also very, very important as we have to face the next pandemic. And pass it over to Iancu.
Thank
Director
you.
Yanku.
And I actually have a two-part question. This is going to be our last word, so to speak, because we're coming to the close of our hour. But I couldn't think of a better person to end it with some comments from Director Yanku. And the two-part question is thus. First off, you're in private practice, Director Yanku. A company has come up with a potential solution to a health emergency, but it's also the underpinnings of their entire company. So the value of that company, the technology that company has brought to bear is the underpinning of what potentially would be a solution. How do you counsel them, given that it's very possible that in the future, their very ability to put this out there as a solution could mean that there'll be effectively a compulsory license, or the IP will be just appropriated from them. So that's item one. And item two, and this is the last one, this should be a bit of a softball. How do we improve the IP system domestically and internationally so that we are in the best position in the future to respond to further health emergencies? So thank you.
Well, look, first of all, I am optimistic that the proposed waiver of the WTO will not go into place. I'm optimistic that push comes to shove after significant discussion, the countries of the world will see the better side of valor here is that the IP system needs to be maintained and in fact improved. And even if a waiver is put in place, most likely it will be quite narrow. So depending on what the new company that's coming to me with, the invention they're coming to me with, they're actually inventing, I would say that there is likely still going to be a good intellectual property system, both in the United States and around the world. And they should pursue their innovation and try to raise funds if needed and go forward as best as possible. You know, if it's specifically a COVID-19 related technology that is right in the eye of the waiver proposal, that's a bit of a bigger risk, and hopefully we will know sooner than later where that lands. But I do think it is important that we don't give up on innovation, and we fight hard to keep and improve our IP systems and encourage our companies here in the United States and our trade partner with our trade partners as well to keep inventing, keep investing in new technologies, and help move the world forward. On your second question, Henry, there are many things that go into having a robust intellectual property system. The most important thing ultimately is the reliability and predictability of the rights that we issue. In other words, a patent or a trademark or any other type of intellectual property is not worth very much if it is not meaningfully enforceable. So we have to make sure that obviously that we issue good rights, that we make it accessible to as many people to obtain those rights as possible. But in the end, governments have a responsibility to make sure that the rights they issue will stand up to scrutiny and then can be enforced if infringed. And there is unfortunately a lot of push, at least on the second part, on the enforceability. There are a lot of little challenges here and there, and then there's some very big challenges, such as the waiver, that want to weaken our ability to enforce intellectual property rights. This is especially true in the biopharmaceutical industry. And that needs to change, because without that, you can have all the patents and all the trademarks and all the IP you want, but if you can't reliably enforce them when needed, then they're not worth very much. But I'm hopeful that, again, cooler heads will prevail and the system will move in the right direction.
Thank you, Director Yanku. Also, thank you for your leadership during a really important time in our country's history in the role of being really the head of our IP system. Very much appreciated. I also want to thank the entire panel for a great discussion today. We've had some terrific industry leaders talking about the role of industry in responding to the pandemic. And we also thank your companies and the entirety of industry and the response to the pandemic. Hopefully, you all will have an opportunity to enjoy the rest of the IPO Education Foundation event. And we thank you for participating and for your continued support of the IPO Education Foundation. Have a good day.
Thanks, Henry. Take care, everyone.
Thanks.
Thank you
Thank
all.
you. Bye-bye.
Bye.
Bye-bye.